we are providing administrative and research support to the Wyoming Frontier Information Steering Committee. And this is a meeting of the full steering committee. The last steering committee meeting was November the 2nd. And so what we want to do today, Andrea, are you driving or is George or Tim? Okay, great. If you want to sort of follow through with the agenda with us, we are going to do a very brief introduction. We want to present subcommittee reports to everyone because since the initial meetings back in November, some of the subcommittees have been active and some have met and had a kickoff meeting. So we'd like to present very quickly the status of the subcommittees. I know that WDH would like to speak briefly about the RFP status and the IAPD. And for those of you who are not familiar with the acronyms, that's the Implementation Advanced Planning Document status. And then what we really want to spend the most of our time on this afternoon is providing you some information about the Healthcare Partners Needs Assessment status. One of the first steps that we undertook to sort of go through the assessment process was to develop a survey and send it out and get results and do some analysis. And we're at the point where we have closed the survey. We have approximately 500 respondents, and we'd like to present very sort of initial factual information about what we are learning through the survey process. So that's what I know. That's an awful lot for an hour, but we're really hoping to speak quickly and get to the needs assessment results as quickly as we can. And then before we leave our meeting today, we will do a meeting wrap up and make sure that we get our next steps in action. All right, thank you. And so briefly, the full committee it consists of all the folks that are on this particular slide. And I know from sort of the software that we're using, there are many of you who are on the line today. Some are not able to join us. So I don't know that I want to take a lot of time to introduce everybody, but I would like to take a moment to ask folks to say hello and participate and let us know that you're here. So let's start at the top left. Terry, if you're here, can you say hi? I don't think she is. Ruth Jo, can you sort of move on down the list on the left?
Yes, thank you. This is Ruth Jo Priest.
Andrea?
Good afternoon, it's Andrea.
Tim?
Hello, this is Tim.
Dr. Bush, are you available today?
Yes, I am here.
Excellent, thank you. Jan Patterson is me and I'm here. Chris? You're on mute. All right. George Raposo, are you here?
This is George.
Thank you, George. George is a member of the PCG support and administrative staff and will be providing informational updates for the team. Kim? All right. Natalie?
Hi, Natalie Blanca here, part of the PCG team, also providing support.
Thank you. Dr. Gee, are you with us today?
Yes, I am. Good morning.
Great.
Good afternoon.
Hello. Angie Van Houten, are you here today? All right. Eric, I think I saw that you're...
This is Angie. I just got on.
Okay, great. Thank you. Eric, are you here? You can hear that my dogs are here. Terry Johnson, are you here? Dallas? David? Debbie? Gerald? Jesse? Jody? Linda? Matt? Niall? Rick?
Hi, that's Rick.
Hey. Ryan? Sheila? Wendy?
Good afternoon, everyone.
Thank you. Dean? All right, so that was the roll call. Are there others who have joined us whose names are not sort of formally on the slide?
Hi, it's Chris. Can you hear me now?
Yes, we can hear you, Chris.
Okay, better.
Thank you. Yes, great. So let's move on and give the subcommittee reports. And again, we don't want to take a lot of time because we really do want to spend our time today on the health partner needs assessment work that's been done. But the sustainability subcommittee has met 2 times. The work performed that we have completed so far is that we held our kickoff meeting. We discussed our governance process that we need to be sure everyone is familiar with around how the subcommittees will do their work and present up to the full steering committee. This subcommittee actually approved its charter and work plan, and the committee members wanted to absolutely sort of continue to move forward very quickly with sustainability work, given that this is one of the key aspects for a Wyoming Health Information Exchange. So one of the initial pieces of work that the Sustainability Subcommittee has started on is trying to sort of gain a clear understanding of the current status of health information exchanges across the country. So essentially, we have provided some information around current status across the country, and we do have spreadsheets about this information that is on the website that I think we'll show you at the end of our meeting today. And we also provided another worksheet that included successful health information exchanges and sort of criteria and analysis around what some of the successful HIEs do or don't do that some may also do differently. So we're trying to sort through some lessons learned and some reasons for HIEs to be successful. And that's what we're sort of focusing on for sustainability going forward. The Sustainability Subcommittee will meet next week, and in preparing for that meeting, we were asked, PCG that is, was asked to research some transmission costs. In other words, what are some of the cost points that other states are experiencing for their HIEs? And we are speaking with the state of Delaware, with the Delaware HIN. We also want to make sure that we include the Wyoming statistics in some of our research that we've been doing across the country. And another aspect of research that we are doing to provide information for the Sustainability Subcommittee is to obtain copies of provider contracts and sort of materials that other providers and participants in an HIE, what documents they sign, what information they provide, how they actually contract with the Health Information Exchange. And I know that that's sort of work that we are planning to present to the Sustainability Subcommittee next week when we have our meeting. And I know that Dr. Gee and I think Dr. Golder is on the line. Gentlemen, do either of you have anything else you want to add to the subcommittee report?
I don't. This is Dr. Gee.
Okay.
Yeah, and Dr. Golder here, and I don't either. I just, again, stress that for me is the most important thing, is that sustainability plan.
Yes, thank you. All right, so that is the report from the Sustainability Subcommittee. And I think rather than taking questions from the full steering committee at this point, we really want to make sure that we present our information about the needs assessment. So if folks are willing to hold questions until the end of the meeting, that would be very, very helpful. Although if anyone really would like to ask a question or make a comment now, of course, that's perfectly reasonable. So I'll pause for a second to see if there are any immediate questions that we need to speak to. All right, so sustainability. Now the next committee report is from the technical subcommittee. Chris Smith, are you prepared to present that report?
Yes, can you hear me okay?
Yes, I can hear you fine, so I'm presuming everyone can.
Okay, great. This is Chris Smith, and we've been working on the technical subcommittee on several different items. We have had our kickoff meeting, and we've actually had, I believe, 2 meetings to date. We've talked a lot about governance and tying that back into this committee. And also we've talked about key components such as the project charter, which has been developed, and the work plan, which is in progress. We're also starting discussions on some of the upcoming and newly released requirements such as MACRA and NIPS. We're talking about things like care equality in Commonwealth, and talking about other technical components and technologies and discussions that would impact the HIE, and really go from there. So I guess my pitch is, if you're interested in any of these areas, we certainly do have room for other members. If you're interested in the technical subcommittee, we're making good progress and really diving deep into some of these areas. Jane?
Thank you. Yeah, thanks very much, Chris. Does anyone have any burning questions, or are we ready to move to the next subcommittee? Okay, so can we go to, okay, so privacy and security. Again, this is a subcommittee that has kicked off. We have had a governance conversation. There was a decision at the time to hold off any further meetings with the privacy and security subcommittee until we got further into the procurement process. And so we do plan to have another meeting in the spring of 2017. And as Chris is sort of saying, we certainly are happy to have any members of the steering committee participate in the privacy and security subcommittee as well. And we will, at our next meeting, we will finalize the governance documents and start to put together the plan for what the privacy and security subcommittee work will be for the steering committee. All right, don't hesitate to jump in if anyone does have any questions that they need to ask before we get through our assessment discussion. So the next subcommittee is the Legal and Policy Subcommittee. Natalie?
Hi, this is Natalie. The Legal and Policy Subcommittee has also kicked off. We've had one meeting to date and have had governance conversations. Similarly to the Privacy and Security Subcommittee, we have held off until we get further along in the procurement process, and because there tends to be a lot of overlap between legal and policy and privacy and security, we might move towards integrating these two subcommittees into a single subcommittee, but that's really up to the members of these subcommittees to decide. We've developed a project charter, which we will finalize at our next meeting, and we are beginning to develop a legal matrix to help understand to use it as a tool for what kind of entities are able to participate in the HIE, what is expected of them, and kind of the legal documentation required of HIE users and onboarding those users. So we will look to the legal experts on this subcommittee to help populate that legal matrix.
Thanks, Natalie.
Mm-hmm.
All right, after a brief pause. All right, so the Provider Outreach Committee has also been very active since the steering committee in November. Kim, would you be able to speak to the work that's been developed? Kim, Kim, are you on silent or not here?
Hello?
Hello, is that Kim?
Hello?
Hello, Kim, is that you? Okay, great.
Yeah.
All right.
Sorry about that. So we had our first subcommittee meeting towards the end of November, and it was a very productive meeting. We started talking about governance and the project charter, as the other subcommittees did as well. Next week, we will have another meeting in which we'll finalize the project charter and talk about work plans. One of the key decisions that was made is that provider engagement, like a really aggressive effort, would be held off until the HIE was being developed. At that point, we would have a lot more to share with providers. But we are still doing some provider engagement. A lot of the committee members told us that it was most effective to reach providers and their administrators through newsletters. So we've been working with different associations and getting a blurb in about Wi-Fi through their newsletters. So yeah, there's a meeting next week. If anybody wants to join, let Andrew or myself know and we can forward the invite.
All right, great, thank you. I think that's sort of the quick summary of the work of the subcommittees between November and today's full steering committee meeting. So I think the next slide is the needs assessment. Oh, sorry, Ruth Jo, I was going to jump right over that, so I apologize. Ruth Jo, I think this is something that you wanted to speak to on the RFP status.
Yes, I did. So the RFP has been approved by CMS and is currently at state procurement. So it has passed the OCIO review and comment period. It was approved at the ETS level, and it's currently at the procurement agency to be released as soon as we get the final approval for the CMS funding. So there were no issues. All of the vendor comments were incorporated with the WDH answers, and they're available on the Wi-Fi website with all of the documentation.
Thank you. Again, we're happy to take comments now, but we're also happy to hold till the end of the meeting. All right. So the IAPD status, I think that's you as well, Ruth Jo?
It is. So the IAPD, we have had a number of meetings with the Centers for Medicaid and Medicare and Medicaid, CMS, and we have revised our IAPD documentation to meet their needs and for some of their planning purposes. We are currently in the approval queue for final signatures, so we're hoping for that final approval for the financial components of the IAPD, hopefully in the next week or so. As soon as that happens, then I will have the RFP sent through the final phase of procurement, and they will post it on the public purchase website, and we will send out the notifications to anybody that expressed an interest in knowing when that would come out. Also, if you are registered on the public purchase website, you will automatically get notification that that RFP is available.
Thanks, Ruth Jo.
You're welcome.
So at this time, I think we are ready to sort of go through the health partner needs assessment results. And Kim, I think you're prepared to sort of give a high level of the process and what we went through and some high level sort of raw data results for this group this afternoon.
Yes, can you hear me?
Yes, we can hear you fine. And sort of for all the participants, I think it's important to recognize that what we're going to present this afternoon truly is not analysis, it's not recommendations, it's not really anything other than the presentation of what survey results were and the sort of showing you how the questions were answered by those folks that participated in the survey. Okay, Kim, it's all yours.
Yep. All right. So as some of you may recall, in our last steering committee meetings, we had discussed that a healthcare partners needs assessment was going to be released, and that was done in mid-November, and it was officially closed last Friday at the end of day. So the last couple of days, we've been just kind of looking over the data. So as Jan mentioned, this is really very preliminary analysis, if you want to even call it analysis. So we don't want to draw any conclusions from this data, but we just thought that the face value of it was still very revealing, and it could help inform subcommittees as they develop task and work plans. So just a brief overview, there were 482 respondents. Over the course of the last month and a half, we did send out reminder emails 3 times, so we had a good response. We're still kind of looking at the final numbers in terms of the response rate, just because we did send out to a large group, but some emails bounced back. So in the next couple of weeks, we'll dig further into the data and provide a more in-depth analysis for everyone. So just briefly, we did send this to a very wide cast of providers. The environmental scan that was completed last year, as some of you may remember, was really focused on primary care and hospitals. And this time, we really looked at all the healthcare partners across the care continuum. So as you'll see, that behavioral health actually had a really great response. 110 people responded from there, and then we had a mixed bag of other types of providers. So just to keep in mind when we look at the data, those were the type of providers that responded. Thank you. The next one, which county is your organization located? So I just wanted to note that Larimer County did have a high count. For some reason, the data wouldn't transfer into the graph, so I just want to note that. So sorry about that. But Larimer County, of course, which Cheyenne is located in, is a high population area, and we do receive a lot of responses from there, which makes sense. And it had about the same amount as Natrona County, where Casper is located. So this is pretty representative of the population distribution in Wyoming. All right, next slide. So this one, we asked providers to rank from a scale of 1 through 5 the methods in which they most frequently use to exchange data, 1 being the highest, 5 being the lowest. So this one is pretty telling. Fax ranked number 1 as the highest, and health information exchange ranked number 5. So of course, with the HIE effort, the idea is that these ranks would be switched. But you can see there's other different methods, such as direct secure messaging and a shared EHR vendor. The next question was, what's your current level of data exchange? So 1 means that they do not exchange any data electronically. 5 means that they exchange all of their data electronically. So definitely 1, 2, and 3 had very high responses. Next slide. And this one was really to understand the referral patterns of the providers. So it asked, what are your clinical referrals to and from? Some respondents selected only 1 state. So this is this graph in the following slide. Some states picked multiple states, which makes sense. So we broke it down into 2 different graphs, although this was 1 question. If you go back to the previous slide, please, real quick, you'll see Wyoming was the one mostly chosen, which makes sense. And then after that was Colorado. And then in the second graph, you'll see, sorry about that. In the second graph, you'll see that Colorado and Wyoming were also chosen multiple times as well. All right, next slide. And then again, this is to understand referral patterns and the relationship between different trading partners. So we asked, what are the 3 primary entities you currently exchange data with or would like to exchange data with electronically? Number 1 was local providers, and then we also have hospitals, labs, and behavioral health and radiology ranking pretty high. And there were plenty of answers to this because we had an option of putting in other and people filling in the blank, but we chose the top choices in here. And we let the providers choose 3 different entities just to get a better understanding of the referral patterns. So you'll notice that if these numbers do add up to be greater than 482. All right. Next question is, what's your biggest concern with sharing data electronically? And privacy and security was ranked the highest by over 100 respondents, and then financial costs followed shortly after. So I think those are 2 things to note for the Privacy and Security Subcommittee and also the Sustainability Committee Subcommittee. Next question is, what's the biggest obstacle for exchanging or not exchanging data? The number 1 choice was electronic health record system at the provider's facility or other provider's facility unable to exchange data. So obviously an HIE would greatly impact that and help that obstacle. And also, if you see the the third and fourth row up, no infrastructure implemented at other providers' facility, and no infrastructure implemented at the provider's facility was also an obstacle, and those two combined is a pretty high number, and that's basically the same issue as the number one choice of not really having a system to share information. And then how likely would you exchange data electronically if you had access to an HIE? This one had pretty positive results in terms of, HIE development. 3, 4, and 5 all had high numbers. So it shows that most providers are willing and want to use an HIE. And then the last question is, please indicate how you would like to see the HIE become a sustainable entity. And by a large margin, most providers chose usage fee, so that's based on actual volume of usage, followed by cost savings, which is based on projected operational costs saved by each stakeholder joining the HIE. So I know we went through that pretty quickly, and this is all pretty high level, but we just thought this was pretty interesting to look at right now, and we will provide a more in-depth analysis after. So if anybody has any questions or comments about any of these questions or just things that you would like to point out, you can share them with us right now with the group. Right, Jan, did you have anything you'd like to add to that?
Sure, Kim. This is Jan, and I really do want to be sure that the steering committee has access to the information and the results and our subsequent analysis on the survey. And I know that we are planning additional outreach efforts and sort of continuing to assess the market for HIE in Wyoming. It is really important to us, so that we hear from you folks as members of the Wyoming healthcare community. And if you are not comfortable speaking at a steering committee meeting, but you do want to participate, that's exactly what the slide on the screen has now, which is the email and the website. We also are making sure that information that is provided to each of the subcommittees for their work and their consideration is available to the whole steering committee and each and every subcommittee member. So you'll see the little bullet on the bottom of this slide that says passwords are currently being reset. And I know that that is something that we really want to make sure that everyone has access to all of the information that's being provided to the subcommittees while the subcommittees are doing their work. So that is sort of the formal agenda for our meeting today. I am happy to take any open comments or questions before we adjourn. All right, I'm not hearing that anyone has a question or a comment for the full steering committee meeting. Our next meeting will be in the next quarter. We haven't set a date yet, but we plan it to be most likely towards the end of March, and we will have more information to provide, and we will look for our subcommittees in the meantime to continue their work and to provide the information and updates to the full steering committee. So if there's nothing else, we can adjourn our meeting. Thank you, everybody. Appreciate your time today.